I first did a piece on this idea that the electromagnetic fields from power lines can cause cancer. Wrote that for the Atlantic. That was based on the field of observational epidemiology, and everything I had learned from my first two books about what it took to do science right was considered an unnecessary luxury in the field of observational epidemiology because they couldn't experimentally test their theories. They didn't think it was important to experimentally test their theories. And so I've been writing about epidemiology ever since.
Why do you think that is? Why do you think it's not? Why do you think that they think that way?
Because they have no choice. It's essentially an observational science. When in the infectious disease world, you can basically test your theories by removing access to the vector of the infectious disease. But in the chronic disease world, classic example, saturated fat raises the risk of heart disease. In order to study that experimentally, since you're looking at a chronic disease state that develops over years or decades, you need an extraordinary amount of subjects who will adhere to, say, a saturated fat rich or poor diet for years to decades, long enough that you could see a significant difference, if the hypothesis is correct, in chronic disease rates. Those experiments are exceedingly hard to do. They tend to cost tens of millions of dollars, if not more. And then it gets tricky. Since they've invariably tended to refute the hypotheses, the community has considered them unworthy of further pursuit. They'd prefer to tell us that the hypotheses are likely enough to be true, that we should change our diets. And when I moved into nutrition in the late 90s, I've been writing about and reporting on those issues ever since.
Mm-hmm. Yeah, I recently wrote a piece that had to do with nutritional epidemiology and just how much of it is basically total garbage. They often collect data through questionnaires that are self-reported from people that can't possibly measure what they say they're measuring with any degree of accuracy. And then from there, basically just go on statistical fishing expeditions, and you're inevitably going to find some things that are significant and report on them. And not only does that happen, do those studies get published, but they often get a lot of public attention and media attention, which tends to propagate in people's minds the notion that the headline results, are in fact true and they're based on sound science, when in fact they're not.
Yeah, and I completely agree with you. Except I think that's not the major issue when it
Mm.
comes to nutritional epidemiology. Even if they could measure the diets perfectly, physical activity and diet perfectly, you still, from an observational study, it's this cliche, association is not causality.
Mm-hmm.
You ultimately end up with only an association that tells you that people who engage in a particular dietary behavior or physical activity related behavior have more or less risk than people who don't. And now what you have to determine is that risk determined by the behavior, or is it determined by the type of people who engage in that behavior? So for instance, the classic example, and there's two now, ultra processed food consumption and the benefits of mostly plant diets and the relative evils of meat consumption.
Mm-hmm.
And it's funny, this was captured for me 20 years ago by a friend who said it's like they're studying um, vegetarians in Berkeley who eat at the famous restaurant Chez Panisse after their yoga practice and comparing them to truck drivers in West Virginia who eat at Denny's, and then
Yeah.
saying that the difference in their health status is the meat consumed.
Mm-hmm.
And that is maybe a little bit hyperbolic, but even saying maybe might be a hypothesis. You're basically taking all the people, when you study ultra processed foods, for instance, which is the latest fashionable research, is an article about it in the New York Times today.